So this is the actual UCAT website, which most of you may already aware of. The UCAT website is quite nicely filled with various instructions, question patterns, some model questions, and some tips and tricks, etc. The main thing what I'm going to touch in the website itself is there are only four sections: verbal reasoning, decision making, quantitative reasoning, and situational judgment. Those who have some elder siblings, there was a section known as abstract reasoning, which was quite difficult for the student and also for the tutors to treat. But fortunately, that section was removed, and you can see the number of questions and then how the scoring is happening. The main thing to note from this is UCAT is a very, very time cautious type of the exam. If you see for the verbal reasoning, is the only one where the number of questions were almost double compared to the available number of minutes. So literally the candidate has only half a minute to solve every question. And similarly for situational judgment, it's like 69 questions out of 26 minutes. So it's very, very, very time restricted exam, and the candidates have to be trained in a very specific manner. And the marks and how the situation judgment is scored, everything is in the website. Possibly you will be able to revise yourself in the own time. Now coming to the actual program, what we do, how we do this kind of work is, it is a shift from the ordinary to the brilliant. Actually, given the choice to me, nobody needs any program, nobody needs any training, nobody needs to buy any online question banks, etc. All the students have to do is to do their A levels properly, get a good predictive score, and make sure the predictive score is happening in the final A level, and then do the UCAT mainly based on the UCAT website, for which you are paying good amount of money. But competition is a competition, and we all know with the Asian blood running, we all wish to do that extra mile to make sure our children are getting into the medical school. Both me and Dr. Ramesh have got children who are studying in medical school, so we know the exact journey which is needed. That's why there is a need for shift from ordinary to brilliant. Just depending only on the UCAT resource is making a student handicapped compared to the other competitors, because end of the day it is a competitive exam. Your scores should be matchingly good enough to enter the medical school, and the higher the best. Higher the medical school, you will be able to think about Cambridge, Oxford, or whichever the medical school you wish to join. Philosophy of speed is the underlying mantra, I will say. Thinking even half a second more than what is necessary is absolute waste of time. Nobody is expecting your children to score 100 out of 100, but just like any other exams in the Asian countries, slowly the benchmark of the marks are climbing up every year to the level of higher competitiveness. And only a brilliant thinker with a very good kind of thinking capacity in a correct way. It's not just speed thinking, it's also the correct thinking in a correct speed way can win the game. For example, in the verbal reasoning, you can't read the paragraph. Our teaching methodology is, once we see the paragraph, the candidate should be able to see the keyword like dates and verbs and pronouns, and from there they will stop reading the paragraphs, they will be start hunting the keywords, and from there answering the question. I used to think why the A level students have to undergo these kind of verbal reasoning type of exams. But then when I reflected into my own practice, I'm a urology consultant. I'm an associate professor of urology in University of Birmingham. Say for example, if I order a patient, I'm sure most of the parents in the group may be doctors also. If I order a patient presenting with blood in the urine known as hematuria into a CT scan, the CT scan report will be like a one full page explaining like liver is normal, lower lung base is normal, kidney showed only some small cyst, bladder is normal, etc. If I go on reading every line of the CT scan, MRI, and all the reports which jumps into my email, I will end up taking a lot of time in making a decision and treating the patient further. I'm able to glance through the CT scan in one go to say that, okay, urologically, kidney got simple cyst, but no actions to be taken. And next line is my dictation letter. So definitely there is a good value of somebody who can do good verbal reasoning to flourish as a good doctor. So every UCAT subset has got a very direct meaning in sculpting whether the particular student is going to be a good doctor in the future. And the slow, ordinary way is to go through the paragraph line by line while we teach them how to identify the keywords and quickly locate it and make sure it's doubly mentioning only the correct thing like yes or no. And time saved is huge. For every verbal reasoning, we can save easily 45 seconds, which will help them to score a lot of good marks. And the slow ordinary way of thinking is thinking about, like, for example, if there is a verbal reasoning paragraph on phototoxicity, thinking lot of difficult words. The difficult words can be taken as difficult words rather than taking the actual meaning of it. Nobody is going to check whether a person knows what is the meaning of the citrus orontofolia. All we have to do is, okay, there is something starting with citrus, and let's go through the paragraph to answer the question. So we'll try to help the candidates to learn how to find the keywords and check the text, and even if they don't understand the appropriate meaning of the whole thing, they can easily go through the text and get the correct mark. Getting the correct mark is more important than understanding the paragraph, because that is not the need for the hour. And then if you see the other things like there is something known as external brain. In the UCAT exam, the candidates were given a kind of a laminated sheet. So they don't have to really hold everything in their working memory. They can jolt down and use that laminated sheet whiteboard quite cleverly. And that will really make them a very good performer, and will really make them into an amateur scanner to pro scanning methods, keywords, and selecting the anchoring statement, etc. We are able to guide the students to quickly decide from whether it's true, false, or can't tell. Lot of times, if there is something like answer of can't tell, the candidates will wrongly mention it as a false. We need to be very clear that true is true, false is true, false is false, I mean, and can't tell means which is something you can't tell from the paragraph. A false can be easily misguided as a can't tell because they are not very clear on what is can't tell. So it's very important that we are focusing on what is the expectation from those kind of questions. And there are a lot of language spectrum like for example, all, always, never. They are all like totalizing extreme words, and it could be on the other end like impossible, invariable, etc. These kind of language spectrum of extremities are very useful to make a decision, while the center point of mitigating waves like many, some, they need to handle it very carefully. So we will also help them in clearly telling them how to flag a difficult question, not to waste the time, so that in the second run they can come back and look into the difficult questions and spend some more time. Sometimes spending unnecessarily time on a difficult question will make them to hurry up an easy question and make mistakes, losing both the questions. Decision making again is a very good section where application of the syllogisms, application of the Venn diagrams. If the question requires a Venn diagram, we will teach the candidates how to draw a quick Venn diagram so that the answer is literally visually appealing to them rather than they have to think. So the whole decision making can be done in a very spinal level rather than taking it into a kind of a cerebral mind puzzling thinking. And we also able to teach them how to look into the arguments. Is there any factual things, is there any relevant things, how it is comprehensive, if it's a weak argument, how to eliminate the wrong answers, etc. If you look into the decision making, it's more like a logic blueprint. Every question has got a pattern. Once the candidate understands the pattern, the whole knots can be easily undone and they can think much more clearly. Say for example, if there is a question like this, like Jeremy, Tony, Jacob, Lucy are all students. Jeremy only follows two people.
Sorry to interrupt, Anand. Are you sharing the slides? We can't see the slides.
You can't see that? Oh, sorry. I will share again. Maybe it's got missed out. I'll stop share and share again. Okay, you should be able to see now. Okay,
Yeah, we can see.
good.
Thank you.
So in the decision making, the syllogism trap is there, and when there is a syllogism trap, it's very difficult for the student to think in by learning these words. And then everyone follows Lucy, Tony follows Jeremy. So this has to be converted into a simple line diagram. Like for example, J follows 2, all follows Lucy, T follows J. If there are two names like Jeremy and Jacob, we'll teach them how to label it as JE and JA so that they won't get confused. The UCAT questions are constricted and constructed to correct level to find people to make mistakes. And by quick brilliant way of creating a kind of a flow chart, they will be able to come to the results in a very visualizing way. And there are lots of logic puzzles. Again, instead of going through the logic puzzles individually, the brilliant way is to make it like a tabular column so that they can quickly solve the logic puzzles. Quantitative reasoning is mostly for max. If any of your children or the candidates who are in this group are already taken max as the A level, it's a piece of cake for them. But the actual max which is expected for qualitative reasoning is as low as grade 7 or grade 8. It's not a very super duper max. What is expected is how a candidate is not doing the max in a very circumcised manner and take it in a very kind of a quick manner. That is what it's more of like a game. Even though the UCAT gives the access to the calculator, if you are able to do as many things without calculator, that gives the best possible answer. Say for example, if there is a question with a garden of 40 into 8 meters with 200 say carrot plants, something like that. If a normal student without proper guidance will start calculating like, okay, it's 40 into 80, 320 meter square, and 200 plants have to be done. So how many plants per meter square? It's a very cumbersome way. While we advise them just to use the white laminated sheet into a quick diagram, and the garden is massive, 320 square meter, 200 plants, and we can quickly make it like a percentage, which is more than enough rather than calculating everything. The answer is to get the correct answer option and not the correct answer. Once we select the correct option, that itself will help the candidate well. Say for example, if there is a question to calculate 42 divided by 128, by using a calculator, you will be getting a very complex answer of 0.3281. This is not useful at all. Just by quickly plotting this red and white into a kind of a bar chart, the candidate can easily find out, okay, red is something 3 times while white is something 4 times. So the ratio is something like 1:3. And by looking at the ratio, they can go to a quick answer. There are multiple examples where a quick alternative method is much quicker than the correct method, because the whole UCAT, they are not looking for the correct answer, they are just looking for a quick estimate. And for example, if there are answers options like 100, 200, 300, a quick guesstimate will make them to give a good answer by rounding technique. While if the answers are very tightly placed like 10.1, 10.2, 10.3, then these kind of questions we need to come to the correct answer. Just doing a guesstimate will take them to 10, but it won't give them the decimal points. So a precise calculation is needed. These are the questions which should be left out in the first run. It should be appropriately flagged, and in the second run they should be able to spend more time in the difficult flagged questions. And UCAT is an exam with no negative marks, so candidate should be able to answer all the questions. And in the end, if an unfortunately candidate has one or two questions where they can't even manage to read, even then they need to just tick something randomly, B, C, D, something, and we will teach those techniques also quite in detail. And we want to create a very hygienic mental math rather than using the calculator, and calculator should be used in a very hygienic manner, not for every question. The calculator in UCAT is very cumbersome, and data interpretation should be more like visualization rather than actual calculating. And these kind of conversions like distance equal to speed into time, time is equal to distance divided by speed will come multiple times. And by doing more works with us, the candidate should be able to do it quite at the spinal level. Finally, coming to the situation judgment, this is one of the very important thing which I feel has the direct relevant to a particular candidate's medical career, where how much they are giving importance to patient safety, is there any compromise in the public confidence, teamwork, reputation. They need to know the hierarchy of importance, while patient safety is much more important compared to an individual's reputation. So once they're able to prioritize this kind of hierarchy, then situation judgment is comparatively very easier. And what is the appropriateness in the action, what is the importance to consider. And we give correct techniques first for them to differentiate between A, B and C, D. Because in situation judgment, say for example, if the answer is A, if the candidate answers A, they will get full mark. If they answer B, they will get half a mark. For C and D, no marks. Because A and B is like favoring the statement, C and D is like unfavoring the statement. At least they are in the correct half, then they will get at least half the mark. So first step is to secure half of the mark by broadly thinking whether the answer is AD or CD, AB or CD. And then next step is to see whether the particular thing is an extreme situation or in the midway situation. In the extreme situations like compromising the patient safety, it will be A or D, while in the midway situation like teamwork and reputation and all, it will be B or C. It's a very straightforward one which works very well. And execution is very important. There are specific techniques. As I said, this slide will summarize the techniques for every step. And situational judgment, as long as the candidate is understanding the importance of the patient safety, which is very difficult to get into the minds of a A-level candidate, because once they become a doctor or even a medical student, they know patient safety is the most important thing in the world. And there are various slow, ordinary way, while the quick way is to make sure that patient's autonomy is respected. Is it a polite way? Is it aligns with GMC guidelines? We will strongly advise the people to read the relevant GMC guidelines like good medical practice, which we can give them in the initial few studies itself. There are lots of ordinary way to solve the situation judgment, which ends up people to lose lot of 0.5 mark. Every question, if they lose 0.5 mark, that's more than enough to make a difference between a candidate who is going to Oxford or Cambridge or to any other medical school, which they prefer not to enter or enter into a bigger one. And the training is to improve the reflex, find the keywords in verbal reasoning, draw the logic diagrams and make it logically correct in the decision making, estimating rather than calculating correctly in the qualitative reasoning, creating a safety for the patient as the predominance for the situational judgment. And you may all have come across this diagram from the UCAT website itself, which clearly says like you should start at least 6 weeks earlier. That's why it's mentioned as plus 6 weeks. So if anybody has a question of when to start, we will say at least 2 months. And Dr. Ramesh will summarize some programs what we are going to run, like a small cohort 2-month programs and also single one-to-one very tailored programs. We run 2 types of programs, which I will request Dr. Ramesh to summarize. And by having a dedicated 2 months, the candidate will be also able to focus on the A-level exams and various other school activities, and also make sure that the UCAT is done in a correct manner. There is always an option for the UCAT exams to be rescheduled if particular candidate is not ready. We are quite happy to help with those kind of decision makings also. Our UCAT and this medicine package is a very comprehensive one. We do right from, as Dr. Ramesh mentioned, from A-level tuitioning like science subjects to the level of UCAT preparation, then personal statement support, then selecting appropriate medical schools by strategic application, and then going to the level of MMI and tailoring the MMI tuitioning to the specific candidate according to the colleges where they got the offer, and by chance if they end up getting multiple offers, we are there to guide which is the best medical school to take. And we work as a team including the parents so that everybody has a good say in the particular candidate's improvement. And gone are the days where the candidates can work on their own, subscribing to multiple question bank platforms and then work in four walls. The whole UCAT journey has become much more open now, where candidates should learn from each other, creating some small cohort or some one-to-one sessions where a particular candidate's deficiency, say for example, I've come across some candidates who are brilliant in verbal reasoning and situation judgment, but they may struggle with the quantitative reasoning because they may be quite poor in maths and they left out maths quite early in the GCSE itself. And we need to do some quick maths kind of a rush up and then a kind of a brushing up to make sure that they are getting on well. Overall, this UCAT package is a small part of our full package, and over to Dr. Ramesh for further explanations.